I'm Melanie Phelps with the North Carolina Medical Society, and I'm your guest host for today's briefing. I will provide updates on the budget, the Controlled Substance Reporting System, and Medicaid patient and provider protections. Before I cover those items, I'd like to introduce a special guest to talk about the new statewide standing order for naloxone, or Narcan. I'd like to welcome Dr. Randall Williams, who is the Deputy Secretary of Health Services within the North Carolina Department of Health and Human Services.
It is truly an honor to be here today to talk about the Narcan bill that the governor signed on Monday. The Division of Public Health really owes its origins to the North Carolina Medical Society, which established in 1877 what we now would call the Public Health Commission by order of the General Assembly. And in 1881, the North Carolina Pharmacy Board was established, and we've had 15 state health directors since then, and this is the first time in the history of North Carolina that the state health director has issued a standing order for a prescription. And we're very proud that that was done in collaboration with the North Carolina Medical Society, who has been a partner in this. This will allow any of North Carolina's 10 million citizens to go to a pharmacy that participates and request a prescription for Narcan. We think that is vital. As we discussed with Bob Selkson, we're only going to do this every 150 years, but we think that the opioid epidemic warrants it, and we're just so proud of the North Carolina Medical Society and the North Carolina Pharmacy Board and the North Carolina Medical Board and the North Carolina Nurses Association helping us with this. As you may know, it passed through the General Assembly with 8 votes. I testified before 5 committees, and they were all unanimous, bipartisan, both Democratic and Republican support. And so we are now implementing that with the help of the North Carolina Medical Society and others. Again, in North Carolina, we have about 20,000 people going to ERs for overdoses every year. We have 1 out of 4 of our autopsies done by a medical examiner is for overdoses. We have 91,000 prescriptions for narcotics for every 100,000 North Carolinians. So it is a multifaceted problem, but one that we are tackling in many ways. And again, just very much appreciate all of the help and collaboration and advice and guidance of the North Carolina Medical Society in implementing what we think is a historic and incredibly important public health measure. Thank you.
Thank you, Dr. Williams, and thanks to all who worked tirelessly to get the standing order enacted. Now to the budget. We anticipate the budget conference report will be available in the next few days. If that happens, a vote should occur next week, and if adopted, that would clear the way to adjournment sometime before mid-July. One of the provisions in the Senate budget that did not appear in the House budget deals with the funding and operating of the Controlled Substance Reporting System, or CSRS for short. We have heard that the budget negotiators have temporarily agreed to fund improvements in the CSRS that would connect CSRS with other states' prescription drug monitoring programs and integrate the CSRS with the new Health Information Exchange. We understand the language also requires physicians to register with the CSRS, but that it does not include a mandate to check the CSRS before prescribing. The last issue that I'll cover today is our efforts to clarify the mandate from the 2015 Medicaid reform legislation to ensure that the patient and provider protections that currently apply to commercial managed care plans also apply to Medicaid managed care plans or prepaid health plans. We hope to get that clarification into Senate Bill 838. This remains one of our top priorities for this session, and we hope to see some action on this in the next week. So, until next Friday, we at the NCMS wish everyone a very pleasant week. Thank you.